एका ठिकाणी बोलता येत नाही तिथे आता. मी नाही चालू तुमचं तिथं ते आवाज. हॅलो.
Hello, sir. Good afternoon.
Good afternoon.
Hello. Hello.
Hello, sir.
हा आवाज येतोय सर?
येतोय आवाज येतोय.
हा सर स्टार्ट करायचं?
हो चालेल ना, काय प्रॉब्लेम नाही.
सर व्हिडिओ माझा हे करा सर, डिसेबल केलाय.
तिथनं तुमच्याकडनं करता येईल तुम्हाला. एक मिनिट.
ओके.
तुमच्याकडनं हो.
हॅलो. हा प्रवीण सर.
हो बोला ना सर.
ओके.
Yes, ready.
यस सर. खरे सर स्टार्ट करायचं सर?
बिल्कुल सर, बिल्कुल.
हॅलो.
स्टार्ट.
ओके चालेल सर. Okay, let us start with our webinar. Good evening to one and all.
Good evening.
All the participants who has registered for the national level webinar on entrepreneurship or job time to decide, organized by MES College of Pharmacy Sonai in association with Sonai Biotech Private Limited, Ireland, Pune. Firstly, I am very much thankful to Dr. Praveen Bade sir, as well as Mr. Vishal Khare sir, who has accepted our invitation to organize this webinar within short period of time. The aim of this webinar is to motivate the students for entrepreneurial career and make them capable of perceiving as well as exploiting their opportunities for the entrepreneurship development. So let us have small about the MES College of Pharmacy Sonai. MES College of Pharmacy Sonai was established in 2004 under the dynamic leadership of Honorable Prashant Patil Gada. Presently, the college is having D.Pharm, B.Pharm and M.Pharm course in pharmaceutical quality assurance. The college is permanently affiliated to Savitribai Phule Pune University, approved by AICTE and Pharmacy Council of India. The college is also certified by ISO 9001:2015, and the college is well known for its academic as well as research excellence. So as a part of our academic excellence and research activities, as well as to develop the body entrepreneurship, we have organized this webinar to benefit the students under this COVID-19 pandemic condition. Now, I would like to request our principal, Dr. V.K. Deshmukh sir, to deliver the welcome address of this webinar. Deshmukh sir, please sir.
Am I audible?
Yes sir, audible sir.
Audible sir.
Under the MOU with Sonai Biotech Ireland and Pune, today we are going to organize the national level webinar on entrepreneurship or job. Actually, in today's COVID-19 condition, it's time to think for all final year B.Pharm and M.Pharm students to think about their future. And considering this particular demand of the student, we thought that we should have some expert talk, expert guidance on this particular point, so that our student can decide properly for their future. I am very much thankful, and I, on behalf of management and college, I welcome Dr. Praveen Bade sir as well as Mr. Vishal Khare sir. They have given their time and they accepted our request to have a webinar on this particular sensitive issue. And considering this particular era, it is basically all the final year students before that, it may be form student, they should think with what they have to do in the future. Either they have to go for entrepreneurship or they have to go for the job. And for the pharmacy, it is both the sectors, we can say, it is really very good open. All the pharmacy students, they are having proper placement, as well as they can go for their entrepreneurship. And Dr. Praveen Bade sir is the well example in front of us. We have the entrepreneurship. We had Praveen Bade sir with the Sonai Biotech Airline. We had very good only. Today we are going to organize a webinar. So on behalf of management and the college staff, I welcome Bade sir as well as Vishal, and I am very much thankful to Sonai Biotech Airline for their cooperation. So without taking much time, I request Bade sir and Khare sir to start their talk. Thank you, sir.
Thank you very much, sir.
Thank you.
Thank you, sir.
Yeah, sir.
Yeah,
Should I start?
Thank you, sir.
Dr. Praveen, you are starting.
Yeah. Mohit sir, should
Yes,
I
sir.
start? Should I start?
Yeah, yes, sir. Yes, sir.
Okay. Thank you, Mohit sir, and thank you, Deshmukh sir, for inviting us. So, hello everyone. I'm sure that the voice is clear, nice and clear.
Audible,
Right.
sir. Yes.
Yeah. So, thank you all for joining today's webinar. So we are going to talk on entrepreneurship or job and time to decide. Before that, I'm going to talk about Swalife, specifically about Swalife Foundation. So let me just share you my PPT. Can everyone see my PPT presentation?
Yeah, it is there.
Yes.
If there are any questions, you can ask in the comment box, and we will try to answer as we go. And also at the end, we got a question and answer session. So before actually starting with the seminar, I just want to give some information about Swalife Foundation, which we started in 2008. So I want to talk about vision and mission. So the reason we started Swalife Foundation, the Swalife group contains Swalife Healthcare, Swalife Biotech, and Swalife Foundation. The vision and mission of this Swalife Foundation is to help the pharma field to make the changes which are needed with the mindset of entrepreneur. So we want to make sure that the pharma knows about what opportunities are there into entrepreneurship. One of the mission of MES, Sonai College, Popat sir, मोहिते सर प्लीज जे लोक त्यांचा आवाज तुम्ही म्यूट केला तर बरं होईल कारण
Okay. Yes, sir. Sure, sir.
yeah so we want to develop the entrepreneurial mindset of pharma field people who are doing D Farm, B Farm, masters. We want to help them that there is an opportunity for pharma field into entrepreneurship. Also, we want to educate farmers into medicinal plant growing. So like there is an opportunity there is a scope for this medicinal plant. As you see that there is a need for drug discovery, and I am a believer that Ayurveda got us power of that, but companies, also the research labs need to think about that. So that important thing is the mindset again. And the third mission is to educate the orphanage children's. So with that vision and mission, we started this Sonai Foundation into 2018. I got background. I done pharmacy. I'm going to introduce myself as we go, but here I will shortly just tell you a short introduction that I got a background of pharmacy. I done B pharmacy, and now after doing research for nearly 10-15 years, now we are into startups, companies, and we are developing different products. We are doing research in small molecules targeting DNA damage response pathway in different cancers. We started Sonai Foundation Academy, under which our aim is to share our knowledge and skills with all the people who are into pharmacy field, and also into agri. So the mission was that to increase the knowledge of farmers. So that's the reason we started this foundation, where we are actually trying to build a network of entrepreneurs. If you see when the pandemic, when the corona hit our country, and when the lockdown was done, government has put money into this MSME and the startups, because all over the world, the thing is that the startups, the entrepreneurship field is very important. So that's the reason we are targeting the entrepreneurship in pharmacy. And as a pharmacist, our role is very important. So we started Sonai Foundation in 2008 with this mission and aim. So today's topic for this webinar is entrepreneurship or job, and it's the time to decide. So at the moment for pharma students, this time is that they are nearly finishing their year, but at the same time we are hit by a coronavirus pandemic. And you can see the world is investing into startups, into entrepreneurs to find the solution for this problem. And there are news coming out that there is research going on vaccine, and you will get the vaccine in this month, that month. But things don't work like that. I don't want to go in detail in that, but there is a lot of clinical work, a lot of discovery has to be done before actually it comes into the market. So as per my personal view, I don't think the vaccine will come in, maybe not in this year, possible chances are next year. But there is an opportunity for doing a drug discovery where you can do repurposing, you can also work on small molecules, and there is chances that that medicine will come as ASAP, maybe like in months' time. So there is a time for you people, you as a pharma people, to decide that what you want to go into the field now, which skill you want to build. And for that purpose only, we as a company, we as a foundation want to share our skills. So my aim today with this webinar is to give you a scenario what entrepreneurship is, what I have done, how I have actually gone into this field, and what we are doing and what we are planning. So in short, I'm going to talk about that. So the webinar layout is that the introduction will be there. Then I'm going to talk about what is entrepreneurship, what's the difference between entrepreneurship and business, what are the things, what are the skills you need, how you can develop that skills, and how can you enter in this area. Then we got Mr. Vishal Khare, who is going to talk about marketing skills, which you need for job, as well as in entrepreneurship, as well as in your life. Marketing is very important skill. And there is a question answer session then. So moving on to the next slide, I want to introduce my journey from doing B pharmacy till date. So in 2000 to 2004, I was doing B pharmacy. I done my B pharmacy from SVPMS College of Pharmacy, Malegaon. At that time, I didn't have any idea that what I'm going to do after B pharmacy. I had very nice seniors, friends with whom I spoke about this, and then I got the information. You people are very lucky because there is an internet. You got a lot of information there on website, internet. But the problem is you need to make sure that you are getting the right information, because otherwise you will get lost into the information, and then it's difficult to find out the path. So after doing B pharmacy, as everybody, I started looking for job, and I first started into marketing. So that job was only for 7 days. Unfortunately, I left that job, and then I moved into lectureship. 2004, 2006, I was working as a lecturer in a college based in Pune. And at that time, I feel that, okay, if you want to continue as a lecturer, there is a need to have a higher education. So I decided that I will do my master's, MPharm, and then I can then move the ladder up. There were two reasons. One was the money, finance as well, the payment which you get. And the second thing is that I was more interested to build my skills at that time, because as a young person, you want to get the skills. I started looking MPharm colleges. At that time, the MPharm colleges were, the fee was nearly around 2 lakhs and per year. And there was a donation as well. So I was not comfortable to get admitted, because the donation, the money for which I need was very high. So then there was a friend of mine who is a classmate of Mohite sir, Suhas Gaude. He actually introduced me to a consultant. Once he went to the consultant, and I was just listening, as you know, always like you friend also try to travel whenever you are in the college. You think, okay, let's go and meet people. So I went with him and the consultant, and he was talking about that how the education work in developed country like US and outside India. And then I found that the good thing about the education system is that while doing your masters, you can actually do a part-time job for certain hours. And yes, the fee was more. It was nearly 9 lakhs. But then I went to the bank loan, and I went to that process. And then I went to UK, London in 2006, to be precise, 17th of August. 2006, I was in London, and I started my master's. At the same time, in 1 month's time, I started my part-time, and things was going fine. I done my master's in 2 years, 2006, 2008. At the same time, I started my part-time job, and also I volunteer to build my skills in research. So I volunteer to work in a lab without any financial gain. So that hours don't count. So there is a very strict rule that you have to do only 20-hour job there, otherwise you can get deported. So I was volunteer, so there was no problem. So for 2 years I was working, I was building my skills in research, which helped me to get a job as a researcher from 2008 to 2012, where we work on small molecules from plants, where we targeted different cancers. So in that specific research, I targeted liver cancers. And we were also doing semi-synthetic of the molecules which we identified from plants. So, for the commercial reasons. And in that time, I learned a lot of techniques such as live cell imaging, flow cytometer, HPLC. Then there was a LCNMR, LCMS. So it was something, a very interesting time, because when I done my B pharmacy, I actually hardly looked HPLC in our, I think not even HPLC. It was, I think not HPLC, tablet punching machine and things. So I actually never handled any machine, because after finishing my B Pharm, I was lecturer, and there was no that instrument. So it helped me to gain that skills while doing my master's. So it helped me to get the job as a researcher. And we done a lot of research. We actually applied for British Skin Foundation funds. We got selected, and I was very happy, because with that grant, I was actually going to start my PhD in 2012. But unfortunately, in 2012, there was a problem with the university, and the officials, the government has actually taken out the license. So British government give license authority to university, so they can actually bring students for their university, and that license was revoked. You can Google it and you can find out what happened. So at that time, I was actually in a mess, because then the only option was to go back. But then with the help of the government, with the help of the university, and with the help of the researchers in UK, I managed to move from London Med to Brunel University, London, where I was part of Dr. Ian Kill's lab, the expert in cell biology, where I learned 3D skin model, growing 2D cells, growing cells in progeria disease, cells in different cancers. So we grown skin cancer, breast cancer. So it was more toward cell biology. He was an expert in cell biology, DNA damage response pathway, working on different proteins. I learned from him. Then while doing my PhD from 2012 to 15, I was also a research fellow, where we developed a 3D skin model, which we used there while testing our molecules. I was also part of a group which actually was working on countercurrent chromatography. So I will introduce the lady in the next slide, in the following 2-3 slides. She is there. She helped me to learn a lot of separation techniques. So countercurrent chromatography is excellent chromatography technique, where you can actually separate a lot of molecules using only liquid as your stationary and continuous phase. Then after finishing my PhD, I moved to a postdoc, which is a typical pathway from moving from undergraduate till PhD and postdoc. While doing my PhD, when I finished the PhD, Dr. Ian Kill was the person. He said that the work which we have done in our PhD needs to be moved into commercial product. And he was after me to just form the company and take it to the next level. So while doing postdoc, I was doing with Dr. Joanna Bridget. She is a wife of Dr. Ian Kill. So while doing that, I was looking for investor. I was looking for the skills, knowledge in entrepreneurship. While doing postdoc, I worked on progeria disease, which is a rare disease. You must have seen a movie where Abhishek Bachchan was Amitabh Bachchan's father. Amitabh Bachchan was like, a small child, where he was grown only for 13 to 16 years and he dies. The progeria disease is a rare disease where the person dies in 13 to 16 years and he get all the diseases. So it was a model to test all our molecules in different diseases as well. And we were targeting DNA damage response pathway. But in postdoc, I got introduced to chromosome chromosome, where you can actually get chromosome positioning is there. Then also you can look into proteins. So you can actually look the positioning of protein in certain chromosomes. So we were targeting different chromosomes which get affected into these rare diseases. And DNA damage is also there because once the DNA damage occurs, there is a mutation happening. So your DNA changes, the chromosomes are changing. So it was more towards cell biology and towards the genome instability thing. So you can see that from pharma, where I was in the same boat where you are at the moment. I moved to a different field, which is still relevant to pharma, still relevant to the drug discovery, still relevant to everything. But basic research is going on such a vast in a developed country that you cannot imagine that what things are happening there. And they got all the instruments as well. So we need to think about this entrepreneurship and bring things into our country, so that way we can increase the quality of our research to that level. And that is possible. There is no reason why it's not possible. I will say that Manmohan Singh and Narendra Modi, they have actually done a good job by introducing all these startups. There are funds available, there are incubator centers available, there are facilities. Only thing is that the mindset, the people mindset is not changing, and they're not looking that. So after moving from postdoc, while doing postdoc in 2016, I visited India, and at that time, we formed Swalife Healthcare first. Swalife Healthcare, with my friends, we started Swalife Healthcare first. So Swalife Healthcare idea was generated in 2011, where I was actually working in UK. I was planning to have different formulation manufactured in India and then exported into UK. Unfortunately, that didn't happen. But 2016, when we started healthcare, we were still working on that idea. And then, so in the next slide, I will mention about Swallow Biotech. So while doing my postdoc in 16-17, in 2017, I received funds, investment, only with my idea and the work which I done in my PhD, from a US investor, about $100,000, where they help us into learn the skills about entrepreneurship as well. You have to think like this, that when you are doing courses, you are gaining the knowledge, but there are other things. So if you are thinking about, let's say, if you're thinking about forming a medical shop also, medical shop, the skills which you need for medical shops are not taught in your college, because the syllabus is not there. Yes, there are rules, regulations are there which are needed, but the skills are different. The mindset is different, finance is different, the operation strategies are different, and that you only come to know when you are actually out of college. And our aim as a foundation, as a Swallow Foundation, as a Swallow Group, is to collaborate with the colleges. So we sign MOU with the colleges so that we can actually introduce some of the things, some of the skills in the student at that time. So that way they can choose the career, they can have a mindset where they can build themselves when they are out of college. So if you think like what you're going to do after M Farm, what are you going to do after B Farm, what are you going to do after D Farm? If you're not thinking that, if you don't have the path, if you don't have the goal, it's going to be difficult. If you take an example of a ship, the ship is moving from this country to that country. They know that where they are going. Otherwise, they will lose they will lose the path in between. But that never happened, because the reason is they know that where they are going. So you have to make sure that you have that focus. You need to have that goals. So that way, whatever area you want to move, you have already decided that. So in today's webinar, I'm going to touch about entrepreneurship. Why I'm talking about entrepreneurship? because research is not enough to take the medicine from the lab to the patient. You need to have that mindset where you can help to take that research from your lab to the patient. While working nearly for 10 years, 11 years I was in UK, and then for nearly 4-5 months I was in Ireland. I've seen many scientists, I've seen many academicians, they're working in this setup where they are doing all the basic research, and then they are out licensing their technology to the company, and they're working with the company to bring the medicine in the market. But our problem is that the government budget is mostly spent on our defense, where in developed country, the most of the budget is spent on the research, because the research brings a lot of revenue to them. So I want to talk about the entrepreneurship. So what is entrepreneurship? So developing and managing a business. So if you take a typical definition of the entrepreneurship, it is a developing and managing a business in order to gain profit by taking a high risk. So you are thinking about taking a high risk, you are going to manage a company. So this is a typical definition. I don't think that that's the right definition, because entrepreneur is the person who take that risk to bring an innovative product. So my idea is that you need to have an innovation. Innovation is going to help you to build your entrepreneurship journey to that level. So if you take an example, I'm sure you know about Kodak. If you take that company, Kodak was making cameras. I don't know if you people knows, but Kodak was a famous brand. Means we have used Kodak camera at that time. They didn't do any innovation into their product. And what happened to Kodak? Nobody now knows about Kodak. If you think about Orkut, there was a social media already available called Orkut, which was before Facebook, but they didn't do that innovation. And then the Facebook came and the Orkut is gone. So you need to have that approach. So that way you can actually build a company which can be high risky, but it will give you a high profit. Think about, if you know Elon Musk, he got a company called SpaceX. SpaceX, the idea was to send people from Earth to another planet. Who is going to risk their money on this type of company? But SpaceX is still in the market. They are building the innovative rockets. They are not sending people, but think about what the innovation they done. They are taking the project from NASA, because NASA is also it's a government. So they are getting money from the NASA to build the rockets for them. So as you go, there will be opportunities where you can find that, you can move into this area, and that way you're going to build a startup which can be grow into company, and which will be exited, or you will get IPO. So why I started, no, still. So
Hello.
Hello. Hello, sir.
Continue, sir.
Yeah. So I already defined about entrepreneurship, and I already mentioned what entrepreneurs does. So now there must be a question in your mind that, so what's the difference between entrepreneurship and business? Both are same, isn't it? Because you are doing business, right? You are building a business where it will go into a profit, and you are going to take severe risk. That's what the businesses does. No, businesses are different and entrepreneurship is different. And I already told the difference, and the difference is innovation. The main thing is that you need a unique idea, or you need an invention. So if you think about pharma field, you got a good chance that with the idea, you can move into entrepreneurship. But if you got a research behind you, so people who are doing masters, people who are doing PhD, they need to think about this, because there is a very big opportunity. There is a lot of fund available into research. You just need that mindset to work for that. So I will say that you need to think, you need to build that mindset, because with the idea, if you think about Oyo, I mean, he only thought about that, he got idea that he can actually attach all the hotels with his app, and then people will just book from there. But initially, that was just an idea. You need that strategy as well to execute that. So as you go, as you form the company, you need to keep on innovation. You need to keep on doing innovation. So you have to modify your ideas or invention. So in our case, we have done an invention. We have developed a technology that isolate novel molecules from plants, which we have already shown that they are active in personalized nutraceutical and skincare, as well as it has been effective in skin cancer and breast cancer. So we're moving into that area. At the same time, we are targeting personalized nutraceutical and personalized skin cares. So that's what we are doing. You need skills. As an entrepreneur, there are mainly 3 skills. And when I started my journey in 2016, I always feel that I'm always learning about these skills. It's ongoing process. The main skill is the mindset. You need the mindset. Why? Because you need to convey your message to your customer, to your employees, to your partners, to your investor. So the second skill is your communication. So if once you develop the mindset, you know where you are going, you know that what you're focusing on, you know that what your goal is, then the second skill comes is the communication. And communication means not just talking about in English or talking in Hindi or just writing email. Communication is to pass your message, pass your vision, mission to your all the people whom with you're working, from investor to your customer. And when I say customer, then the third skills come, that is sales and marketing. You need to inform your customers that what are you working on and what they're expecting, what are they going to get from your product, what your customer can expect from you. So these 3 skills: mindset, communication, and sales and marketing. Sales and marketing, it is very, very important skill, and you need that in any case. I'm not saying only entrepreneur. If you are working anywhere, even if you work as a farmer, you need marketing skill, because you are going to go and sell your vegetables or anything. You are even like you done D farm, B farm, or Yum farm or PhD. If you are thinking that you want to do a job, you have to tell what skills you got. So that is marketing, that is sale of yourself. So you need that skill. So you have to make sure that these 3 skills are important in entrepreneurial journey, but also in your life as well. So
Dr. Praveen?
yeah.
Dr. Praveen. With your permission, I want to add a few things.
Yeah, sure.
Yeah. Hello, everyone. Good evening. Yeah, myself, Vishal Khare. I will give you a proper introduction afterwards when my turn will come regarding marketing and sales. But regarding this entrepreneurship, basically, it's an idea. A single idea can change the entire thing in your life, an entire scenario of your future. For that, I give a small example, a story behind this. It's an old story in marketing, is very much common. Might have you people have learned it or maybe read it in somewhere in internet or in Google also. Correct. There are 2 people who are there. Correct. Am I audible?
Yeah, yeah.
So,
Yes, sir.
yeah. So there are 2
Sir,
people.
please share your screen, sir.
No, my screen is not required currently. The screen, all the presentation is with Dr. Praveen only. Correct. We will be handling all the things. My only purpose is to add on entrepreneurship. So for that, I'm telling you just one story which will help you to understand better that what actually the entrepreneurship is and how important it is for you. Correct. So
Okay,
the
sir.
two persons are there. Those two persons, one person have asked them ki, one businessman has asked them to go in a particular place in a small island, and there you have to sell the shoes. The person went over there and he came back running after back immediately after seeing over there, and he came back to the businessman and he told, I cannot sell anything over there because people there, they don't wear at all any shoes. They don't wear, they don't have any custom of wearing the shoes.
Shoes.
He returned back. Similarly, a second person come with a different thought process. He gone over there and he immediately called his boss, superior, or the business owner, that sir, you send me thousands of pieces. Why?
Nobody's.
Because they don't know the basic fundamental or important feature of wearing a shoe or a slipper. They don't know that idea. I have to sell that one idea and I will become successful. This is what is entrepreneurship is all about.
Yeah.
It is my belief that it will be 100% as a single idea you are having, then this definitely going to change your entire life, entire scenario and everything. You have to just need to search for that one particular idea, and these ideas are available. Thousands of ideas are available in pharma industry that we will let you know, and we will guide you. As a solid foundation, we will be helping you out in developing those ideas and working out those ideas actually in the field. Thank you, Dr. Vijay. Please continue.
Thank you. Thank you, sir. Thank you. Yes, that was a very good example. So moving on to the next slide. So in this slide, I'm just showing you that you must be thinking that where the research is happening, where are the big companies that, companies like Ola, Uber, or Facebook. If you see, this is the top exit of the 12 companies, nearly 12, I think. Yeah, there are 12 companies in between 2012 and 2016, and they were working on cancer therapy. So this all companies has successfully done the research and they have exited, they have acquired by another company. So the product they have built is being now into the further research, which will come into the market. So there is, as I mentioned, there is a lot of research is going on. There is a lot of things are going on in the background. We as a pharma, we as a research biotech, we as a healthcare don't do the marketing that much. But if you think about Facebook or any other social media, you will come to know straight away. Before developing that idea, it will be online. But in our field, most work is happening at the background. And in this one, I think the second company, Puma Biotech, and last company, Aragon Pharmaceutical, is from the same person. So he actually in 4 years formed two companies which are based in cancer therapy, and both are exited. One was acquired and one is gone into public now. So there is a high potential. There is a high potential. There are lot of opportunities in this. You can get the skills. If you got an idea, there are people available there who can help you. And as I mentioned that we are doing so many things, and there are so many things happening in background. Recently, just last month, we have actually received a most innovative cancer patient support technology award from Corporate Wire, Livewire, which is a European-based group.
Hello. Yeah, Dr.
Hello.
Praveen. Yeah, Dr. Praveen, is it okay now? Your sound is muted.
Yeah,
Yeah, is it okay now?
yeah, it's fine.
Hello.
Hello, sir.
Just start, sir.
Hello. Yeah,
Yes, sir.
yeah. So,
Okay.
sorry, unfortunately, the light is gone, and we just connected my mobile internet. So that's why it was disconnected. Sorry about that. So, as I mentioned, that we are actually working on different technologies now. So we are into now data science. So like I mentioned, that as the your entrepreneur journey starts, there are things which you need to make changes as you go. So initially we start an idea that we got a technology where we isolate the molecules, but as you go further, you need to then modify as you as the market need is. So now we are into data science, artificial intelligence, and telemedicine. So we are actually now collaborated with few European universities where we are using the data from the patient which are available already in the public domain of European NHS. So like in UK there is a NHS, and we are using that to build a telemedication platform, because we are now moving into personalized medicine. So we want to actually build a personalized nutraceutical, a personalized skincare, and a personalized cancer therapy for skin cancer and breast cancer. So most of the nutraceutical work and skincare work is happening in India, and most of the allopathic, the small molecule work we are doing in Europe, UK and Ireland. With the help of telemedication, we are going to build a platform for doctors and the medical shops. So that way we are actually trying to get the patient consulted online, and at the same time the prescription will be sent to the patient. So that's the idea we are working on. So this thing, hello सर, सर आवाज येतोय का?
Yes, sir. येतोय.
येतोय.
Yes,
Okay.
yes.
Yes, sir. Audible, sir.
Audible, audible.
So we are working on that technology. Just recently, like 3 weeks ago, I mean last month, we talking with some of the investors and also a company in India where we are trying to go into joint venture. So these things are happening in our Swalife Biotech and Healthcare. But at the same time, the what I have experienced in last 2 years after moving into India, that we got a lot of educated people into the field, but the problem is the experience, the skills which they don't have when they are pass out, or even when they are in the market. We actually hired a marketing team last year for different headquarters which are already experienced people, but unfortunately, like I said, the communication is the main goal there, that we were unable to get my vision, my mission into their mind, and we were not that successful in the offline marketing. But then we are not we are still trying with the other ideas. So the second idea is now to train people when they are actually doing their degrees, so that way we can actually hire freshers as well, because they will have the mindset what we need, what experience we want, they will have that when they are coming out from the college. So that's why okay, before before moving to that, I want to just uh, tell a little bit about why I actually started my startup, why I moved into entrepreneurship thing. So this is the man. He is the man who actually has boosted my. He encouraged me. He actually mentored me, and he was. I mean, there are many people, but he was the person there when I actually needed. There are people from India as well. Some of my friends as well. They are very helpful in this. So his name is Dr. Ian Kill. He was my PhD supervisor, but he didn't only just supervise me for my PhD work, but he was also uh, guiding me, mentoring me, advising me in my academic, in my personal life. And now he's part of our Swalife mentoring group, and he is also advisor in the group. With Dr. Ian Kill, like I already mentioned, that I learned a lot of techniques which are now actually helpful for me when I'm thinking about hiring people in research. When I think about hiring, I know that what I'm looking in the person. So last year, not in yes, in last year. So we are collaborated with Talks India here in India, which is based in Jejuri MIDC. So we done some interviews last year, about nearly 30 to 40 people we interviewed for a research position. And unfortunately, means I was actually I was observing, because the Dr. Narke sir, he was actually taking the interview, and he was actually teaching them that what skill you have missed when you are doing your undergraduate. So unfortunately, when you come out from the educational system, no company will hire you because you don't have the skill which are needed. And this is what is different from UK, because I was in UK, but I will tell about UK. Because while doing your undergraduate, while doing your masters, while doing your PhD, you can also get the skills, you can also get the experience, you can also learn the techniques which are needed for the companies, which are needed for different jobs, which are needed for um, which are needed for your entrepreneurship journey. There are also funds available in the university, and that also comes from the university, because these people who are the academicians who do research and who bring a lot of funds as a grant. So I learned a lot of things from him. And then I move in postdoc with Dr. Joanna Bridget. As I already mentioned, Dr. Joanna Bridget, she was my postdoc supervisor. She's a Dr. Ian Skill's wife, and she works mostly on chromosome and genome instability, where we target DNA damage response. And there where I was introduced to DNA damage response pathway in great detail, and also with chromosomes. So chromosomes is also a very major target in different rare diseases. At that time, I was working on rare disease, so that's why I was working on chromosomes. And she is the head of genome engineering and maintenance network. So she is actually a part of a research team which is based in biosciences, life sciences in Brunel University. So when I was actually talking with her one day, she mentioned about as you know that whenever you are into colleges, there is always a fruitful competition. So the lady who is now vice chancellor of Brunel University and Joanna Bridget, they started Brunel University together, but she went to vice chancellor, and she was just head of genome engineering. And the reason she gave me was only the mentors. That she's told me that the vice chancellor has actually got nearly 5 mentors in different areas. I will give you an example. Just recently, a very good actor, he actually died. I don't want to go into more detail why he died, what happened. I don't want to go into that. But if he had a mentors, I'm sure that he wouldn't have taken that action. And the reason is that the mentors help in your life, and you need the mentors. So she has actually explained me the importance of mentor, and that's why Ian Kill, he's always there whenever we need. And then I moved to the third lady. I mentioned you that this is Dr. Shvetlana. She is the director of Advanced Bioprocessing Center, where they work on isolating molecules from plant using countercurrent chromatography. So there is a chromatography called countercurrent where you use stationary phase and mobile phase, and both the phases are liquid. Means in HPLC also there are two phases, but in this one there are both are liquid, and using both liquid phases, there is lot of financial as well. You are saving financially, and at the same time, these people have a instrument, countercurrent instrument, which can isolate molecule in tons, not in milligram, not in kilo. I'm talking about tons. So you can think about the technology they got, because the instrument is available there where you can do extract of tons, and you can isolate a single molecule using the method and in tons. So there is a technology available. So these are the people who actually help me with the science as well as the mindset needed for me to take my work, my research further. They guided me, they mentored me, and then I moved further, and then I formed the companies. So how you can do that? Definitely, there is a lot of already work going on in your institute. This actually webinar was the invitation is from MES, but there are a lot of students. I'm sure there are a lot of students from other institutes, and the mission of MES, one of the mission is that they want to build the entrepreneurial culture in their institute, and that's where actually you need that mission. The institute need that mission, and I like that mission from MSc, because that's why we got the collaboration with them. We got the MU signed with them, so we are ready to do things with them. And also this is the part of that MOU only. So we can help you to build your mindset. As as I mentioned, we got the online presence, we got the Solar Foundation app now, where you can download that app. And also now you can visit the Solar Foundation website. There is a WhatsApp there. And also now we got a network. We have signed MOU with the college. So we are trying to build the network. With that, we actually trying to um, develop the mindset of our student, our farmer student, so that way they can think about entrepreneurship. Then the second thing is the business plan. Like I already mentioned, that you need the goal, you need the focus, you need to know that where you are going. You can't just do D-Farm and think, okay, I can start the medical shop. There are other fields as well. You are doing B-Farm, still you need to have a mindset. When I done B-Farm, I didn't know that what I need to do, because there were no people there to, I mean, there were people, but then, as a student, you are always afraid of going and asking people. So I think for you people, it's very good at the moment, because you are into the culture where internet is providing you such a good platform. I don't remember that we had a webinar, means maybe I didn't attend, but in 4 years, I never attended any single webinar when I was doing my B pharmacy. So this is the opportunity. You need to think about it. You need to plan your things. So with the entrepreneurial mindset, with the idea, you can build your mindset. We can help you in that. You can have a business plan for that, which is helpful to show that you are going in a one direction. Definitely, as you go, the plan will be changed. But you need to show the investor. You need to show the bank. You need to show the angel investors. There are a lot of people who are ready to invest into your company. And why I am saying you this, because I have already done this. I have approached to an investor with the business plan, with the idea, and I have convinced them that the company can be grown to there. And now again, we are raising the seed investment, and I am into the process of that. So there are possibilities. There are things which you can do with the help of the mindset, with the help of the planning.
The third is the operation strategies. You need to have the operation strategies in your mind, that how you going to take that idea, how you going to take that business plan further. So that thing is there. Then the marketing, as I already mentioned, and after my presentation, there is Mr. Vishal Khare. He will be talking more about this marketing, because marketing is very, very important thing in this whole of our life as well. And then the fifth one is finance. Many people, as I mentioned, just come into entrepreneurship or start the business, people will think, where is the finance? I already told you, there are a lot of ways. Only you need the mindset, you need the idea or invention. There are people who can invest, and it's not only the people, there are governments now, they are putting grants. We got Horizon 2020, we got Innovate. We are applying for that, because as an Irish based company, European based company, we can apply that, and with the help of the collaboration in India, we are applying that. So that way there is a money in the research. And then as I mentioned, the sixth thing is the mentorship and the advisors. Any company or any startup or any small proprietorship also need the advisors and mentors. Mentors are very important. You need the mentors in different areas, your personal areas, financing areas, marketing. So like as we got Mr. Vishal Khare, so all our marketing ideas or anything, he is mentoring Swalife. He is a part of Swalife. So we need the mentors, we need the advisors. So that way we will come to know where we are going wrong. And at the same time, decision is yours. It's not the mentor or advisor's decision. You are taking decision. So you will come to know the other way of your thinking as well. So if you're taking any decision, and if the mentor is saying this is, you need to think about it, definitely you come to know the other way of that problem. So in these areas, we can help you. And for that reason only, we have formed the Swalife Foundation Academy, where we are trying to build the science entrepreneurship platform. Here, my vision and mission is to build the skills of the student, so that they don't come to us as for a job. We want to actually associate with them, because every mind can have a different idea, a unique idea. And I don't want to take their idea and develop my company. I want to help them to build their idea in collaboration with Swalife Group, and we want to be associated with them. So that way they can actually take their idea, they can build the people in entrepreneur, they can build the skill of other students. So we want to change that way. We don't want to just talk about what government is doing for pharmacy. We don't want to just talk what the regulatory is doing for pharmacy. Diploma syllabus is not changed for nearly 25 or more than 25 years, but we don't want to go and fight, why are you not changing? What I'm trying to say, that there is a lot of stuff available. Just approach, and you can get a lot of more information skill from people who are already in the field. So that's what we want to do in with the help of Swalife Foundation. So here I'm just introducing the course which we have developed for our Swalife Biotech and Healthcare, where we have actually got pre-recorded videos, audios, and articles, which will be available for you for 1 month access, where you will get help to develop your mindset of entrepreneur. Then we will have every week, we will be having webinar like this, where we will be discussing about different topics which are needed to build your skill. And also if you need, then there will be some Zoom meeting, and we will be giving you e-certificate. And why you need that e-certificate? Because it will be helpful for you. Like I mentioned, that you are preparing business plan. So that means you are going for investment. Initial investment you can raise from your family, but at the same time you need the investment to grow further. So that e-certificate, you can show that you've already got a training. So the risk is less when you are getting the investment. So that way bank also can help you. And then we have built a Swalife circle, where we actually got a circle where we will be updating things daily into that network. So it is like a group where you will get information about different areas which are needed into entrepreneurship journey. So initially we actually thought about, I mean, at the moment, actually July, we are actually charging 10,000 for this course. But for this webinar, we are actually making that, we are making an offer of 5,000. So that is the entrepreneurial course where you will be coming into the network of Swalife Group and building your skills. You can go into Swalife Foundation. Hello?
Hello.
Yeah. So you can go into Swalife Foundation website. You got Swalife Biotech website where you will come to know more about Swalife Group, as well as you can contact on the WhatsApp on Swalife Foundation. There is a WhatsApp there. You can contact that number, and we also got an email. So you can always email me, and that way we can have a one-to-one. Before, if you are confused with what you want to do or how you can do, we can have a Zoom call where we can explain you things where you need the improvement. So the course is starting like ASAP, and the first webinar we will be taking from on 10th of July at 11 o'clock. Once you register, we will update with the link. We will give you the access for the app. So Swalife Foundation, there is an app in Google Play Store, which you can download, and then you can access the course. So here I'm all done with my entrepreneurship journey and what is entrepreneurship, how what my journey was, and how you can be part of that, and how we can help you. If you have any questions or if you have any queries, you can ask me in the comment, and also we will have the question and answer session after Mr. Vishal Khare's lecture. So, hello, sir.
Hi.
Mohit.
Hello, sir. Hi, sir.
Yeah.
Yes, sir. Thank you, sir.
Okay.
Hello.
Yeah. Do you want me to
We will have
continue?
question and answer session after Khare sir lecture, sir.
Yeah, that's fine. Yeah. So, Vishal sir, I think you can continue now.
Okay, I can continue. There's no need for any break now.
No, I think.
No
Yeah,
break,
okay.
sir. We can
No break.
continue, sir.
Okay. First of all, let me thank the MES College for giving us and providing us this platform and a wonderful opportunity to interact with such an educated persons. And as a Swalife Foundation, our total sole purpose is only one, that we want to build certain skills to the young ones who are just passed out from the colleges, maybe D Pharma, B Pharma, or maybe further M Pharma also. That how they can pursue their life in the future, and they can develop certain skills in them, so that they will be more among that persons. Like there are lot many people are there, they are going to the job or they are going for an entrepreneurship, but they become failure either in the job interview or in the being an entrepreneur or being a successful businessman. So we will be inculcating those skills in them. On this particular topic is going on. And if you want to if you want to learn the skills and get the job, career versus. Next slide, please, Dr. Praveen. Hello. Introduction. My introduction is, my name is Vishal Khare. Basically, I'm from Madhya Pradesh. A native of mine is Madhya Pradesh. And I did my graduation, B Pharmacy, in the year 1999 from R.C. Patel College of Pharmacy, Shirpur. And I have total experience of 20 years in pharmaceutical industry, in marketing as well as selling. I started my career as a medical representative from Kerala Pharmaceuticals at Jabalpur headquarters, Madhya Pradesh, where my native is, in the year 1999. After 1 year, I shifted myself to Mumbai, and since then I am there in Mumbai only. And I have done few lectures and courses also to build my career into the marketing, which is very well known in pharma industry as PMT, that is product management team. It is brand building activities and to run the company, what is required. And my last assignment was in 2017 January, when I I quit the job as a general manager marketing all India head in Gulfa Laboratories. It's an Alchem group of company where I left, and then since then I was working as a marketing pharma consultant for different companies. This is all about me, that I have started from a medical representative. Being a medical representative, next slide, brother, sir. Dr. Praveen, what we offer. Now, this is the most important question which I have seen, that lot many people have asked a question in the question session, that how we are going to help, how we are going to become entrepreneur, and how we are going to learn marketing skills. So all the jobs, all the questions, they will be answered here itself in the slides only, one by one. After graduation, the first expectation is always in your mind is a job. Let me begin with in between the lines, which is written, which is most important for all of us. Everyone must have definitely seen or visited cricket. A game of means test match, or maybe a football game. So in football game, we consider there are two halves are there. In the first half and the second half, 45 minutes each. The first half of yours is going to be over after you passed out your B Pharma, D Pharma, and M Pharma. This is the first part of your life is over. The second part will be more crucial, which will be deciding the match. Match means who is going to win, who is going to lose. So this is the second part. You need a very good preparation so that you have acquired the knowledge. You have acquired the knowledge. Now all of you know what is an antihypertensive is, what is a paracetamol is. Correct. You know the mechanism of action of it, how it works. But how you can make this product and do certain innovation and become an entrepreneur. How you can sell the similar product which are available in the market and sell the product as a businessman or as an employee of a company or to get a job. So you need to have acquired certain skills and knowledge. And that is where the Sonai Foundation is going to help you out. Second point is we provide an awesome and convenient e-learning platform. Nowadays, e-learning platform is getting more interest during this COVID season also, but it is a most wonderful interaction available currently to update ourselves, to increase our knowledge and to inculcate our skills, increase our skills from the experts which are available. Even I have done sometimes, and I have attended few webinars and lectures to update myself also. Because my belief is learning is an ongoing process of living. And once you stop learning, you will stop living. Third point comes that I personally believe when God has created anybody, once we have taken birth, then God has given definitely one or two beautiful good skills in one particular person. The only thing is that he might be not knowing it. So our purpose, our job is to uncover those hidden potential inside you, the ideas behind you, the activities that are going to help you, and we are going to unleash those activities. We are going to unleash those ideas and uncover your own potential to the best of it, so that you can become a successful businessman, or you can become a successful an employee, a job, or you can become maybe an owner of a company after some time, after doing a job also. There are a lot of examples are available in pharma industry, which are very well known to me. My gurus, those who have started as a medical representative, and now they are owning a very big pharma company. They are director of the company, owner of the company. So this is the entire journey is there. Grab the exciting and lucrative jobs. This is the one of the major opportunity available in D Pharma and B Pharma, as well as other healthcare business persons which are available in the market. As soon as you come out of the college, nobody will let you know that how to face the interview and how to face that interview with confidence. You are having very good knowledge of product knowledge, what we call in pharma industry, that basic scientific knowledge and the product knowledge you are having that. But how to sell that knowledge into an interview to the best of it, so that you will be able to crack the interview, you will be able to get the job. This is where our job is there to help you out and to develop those skills inside you. And I can assure you and I can guarantee you that after getting these particular informations and skills from different persons like experts, you will be having such a good confidence that whenever you're going for an interview, you are definitely going to be selected over there. And this is our assurance from Sonai Foundation. Next point is grab the will with the help of the experts, learn the micro techniques to become a successful entrepreneur or successful person in job in a pharma industry. You won't believe under this COVID season, COVID-19, this infection pandemic, you won't believe that every industry is suffering. Every industry is suffering some losses as well as degrowing very heavily because of the lack of the work. But it is the pharma industry, to be very precise in our words, I will let you know that the pharma industry is basically currently is 1,53,000 crore company is an industry as well as they are growing by 8 to 9% every year. This is the one of the most important thing that is going to be feel us lucky that we are going to get an entry in an industry which is always growing, which is never degrown. So the growth is already available over there, and every single month the growth is available. The number of patients are increasing, number of medicines are increasing, number of doctors are increasing. So our market is open for everything. And to in that market, how you will enter and how you will make your own place and stand out from others. From MES College, this opportunity has been provided to you under this joint venture of MES College as well as Sonai Foundation. Next slide. Dr. Praveen, next slide. Now, what will be the content of the course? This is the most important thing that you have to, the questions will come into your mind. After grabbing a B.Pharm degree, there are lots of questions in your mind. The first question is, whether should I go for a job or a lecturership? What will I do for that particular thing? Or I become an entrepreneur? How I will do that? How I will get a job? Through consultant or through different people, through the known people, but they will give you an platform where you have to interact with a certain people, those who are experts in the field, your bosses, your immediate bosses. You have to face an interview, maybe 1, 2, 3, 4 rounds, and then you have to crack down an interview, and then you will be able to succeed. These sort of questions are there, but how that knowledge and to crack that particular interview, that knowledge, the skills that we have to increase in ourselves so that our every company welcomes us as an employee and they will be happy to being a joint venture as an employee and employer to us. What is the need to be done to get the job? What are the changes that you have to make? What are the changes that you have to make, and what is the improvement that you have to make that we are going to inculcate in you within this particular course? How will you become successful in the job? It is not only that Sonai Foundation with this course we are offering that once your interview is done, you have selected, it is okay. If you are going, your course is done, you are okay. Once you have done the course, you have got an e-certification, and when you are entering, you have got an offer to come to an interview. At that time also, you can call me up, you can email me up that tomorrow or day after tomorrow, I'm having an interview with such a company, and I'll be guiding you regarding how to face that particular interview and what sort of questions they are going to ask you and what sort of answer you will be going to give so that you are able to get selected in this particular company. After getting the job, if you are facing something in between their problem that you are not getting successful in this particular company, so that is also we are going to help you out and we are going to mentor you regarding how to become successful after getting that job. When you are inside that particular job, then how you will become successful in that job particular. Quitting your job is very easy, but quitters can never win. This is what my belief is. And how will I grow my career? These are the questions which are always there in every single person who is coming out after doing B Pharma, D Pharma, or maybe M Pharma. That how should I move about? And in this, we are going to help you out seriously so that your future will be in safe hands with Sonai Foundation. Next slide, sir. The course name is Sonai Marketing and Selling Skills. It includes lots of good things, good courses, good opportunities. It's for 5 days a course. Only every day, 35 minutes of webinar will be there on particular topics. Those topics I'm going to show you. And after that topics are over, we'll be having a wonderful session of webinar regarding how to crack the interview, finding out placement in different companies, in good companies, which are the good companies where you can apply for, and how you can apply it, and how you will be able to crack that particular interview. Answers to the queries, 10-minute sessions will be there every day after 35 minutes of the session each day. And after finishing this, there will be an e-certificate which will be provided to you with the help of MES College. This e-certificate, next please. Now the most important thing, topics. The topics will be covered. Whenever you start any career, the roles and responsibility of that particular career, JD, currently we are used to call it as job description. The job description is there, but in that job description, if it is written that you have to bring the sales, this is a simple thing, that you are being judged by your sales, then how you're going to get those sales, how to get that particular sales, those information will be provided, that what are the roles and the responsibilities of that particular person, sales executive, for which that you are going to interview. Next will be the art and science of communication, which is the most important thing, I believe. We know each and everything, but whenever it comes to communicating the thing to others, as very rightly said by Dr. Praveen, communication means it is not in any regional language or English or Hindi or any other language, by and large. Communication means whatever I want to tell to you, you have understood the same. No matter what the language is, no matter what the medium is. So that art and science of learning, of communication, that will be the 1 day, full 35 minutes talk will be there. Then the customer service. When we go to in the pharma industry, our customers are different. Our customers are 3 basic customers we are having. First is the foremost is our doctors are our customer. Second, retailers are our customer. And third, stockists are our customer. Because we are using with the indirect customers. So that customer service that I'm going to take that particular session in all these 3 different parts. How to face the interview and win a job. This is one of the most important, which I think everybody have it in mind, whether I will be able to select it or not before going to the interview. But I promise you, once you go through this particular sessions, then definitely you will be 100% confidence, and I assure you that you are definitely going to crack down the interview. Which companies should I work with? I am having a total 20 years of experience. I've seen an entire pharma career. I have never done anything else apart from marketing and selling in the pharma industry. So in that, I will be helping you out with my connects also, with Sonai Foundation's connects also. And we are having our own Sonai Healthcare, which is also running our own business in pharmaceutical industry. So there also will be an opportunity available for you with complete training that you can go and you can join directly Sonai. Immediately from day 1, you can join Sonai Healthcare as a company, in particular headquarter, as a medical representative or as a, depending upon the situations, then we can decide. Next, sir. Dr. Praveen, next. Now this actual course costing is 10,000 rupees for 5 days. Total 5 days costing was 10,000 rupees. Every day there will be 35 minutes lecture, and with 10 minutes query session will be there, e-certification will be there. But because we are coming up with a wonderful opportunity given to us by MES College, and I'm very much thankful, this cost has been reduced to half. It is 5,000 rupees for all of you guys who are attending this particular webinar, and it will be through our MES College. And I wonderfully thank especially MES College, our principal Deshmukh sir and Mohit sir, especially for giving this opportunity. Thank you very much. If any queries are there, you can log in and you can talk to us at any point of time. for registration. This is all been already told to you in the previous slides with Dr. Praveen also. Again, there is a separate link is being given to purchase this particular course online. Hello, which is
Hello.
hello, yeah, hello.
Yes, sir. Continue.
Yeah. So the starting date is for this particular course will be 10th of July this month at 11 a.m. We'll be having our first session, that is roles and responsibilities of marketing and selling executives. My WhatsApp number can be shared to you. My only number is there. There is WhatsApp number. My email ID will be shared with you, and all the links will be available so that you can come and talk to me at any point of time regarding any queries before and after the webinar. Daily basis webinar is completed after joining this course. Thank you.
Okay, thank you, sir.
Thank you.
Now we will have question answer session.
Yeah.
If anybody want to ask the question, just on your mic and you can ask the question to Praveen sir as well as Khare sir.
Hello.
Yes. Anyone interested to ask the question?
In the text message box, I've seen a few people.
I-
Afrin Khan.
Sir. Yes, sir.
Yeah, we got 3
Two questions
questions.
are there. Yes, sir. How we can increase our marketing skill? The question is asked by Sneha Chengede, sir.
Yeah, Sneha.
Hello.
Are you listening?
Yes, sir.
Sneha,
Yes, sir.
Sneha, are you listening?
Yes, sir.
Yes, Sneha. I think major questions is already been answered. How to increase your skills, correct? And only thing is that these marketing skills, they require a particular set of sessions, correct? Regarding marketing means you meant to sell, because marketing and selling is two different things. If you want to pursue a career as a marketing person, then you have to develop certain skills, and those all the skills will be available in our courses.
Okay,
Like
sir.
what will be the roles and responsibilities, how you have to develop the sales skills, how you have to develop your marketing skills, and how you can go about further to make your career in the marketing. Is
Okay,
it correct?
Yes.
Yes, sir. Another question is asked by Prakash Amte, sir. What was your key driving force to become an entrepreneur? Hello.
Wonderful
Yeah,
question.
yeah. So, as I mentioned, the key driving force for me was Dr. Ian Kill. When I was doing my PhD, and when we had, doing research, there are lots ups and downs happening, and he was the person who actually guided me, and he was the person who helped me with the his mentoring. But there was also one more thing, like I mentioned, that when we actually got the grant from Skin Foundation, the license was revoked, and at that time I actually emailed nearly 40 to 45 professors from UK, so that I can move from London Met to another university to do my PhD, to do my research. And nearly I received 18 to 20 replies, and they were happy to to take me as a student. But the Ian Keel was the person who actually was slow in reply, but he was fast in actually executing my transfer. So he replied me nearly after 1.5 months, but then he actually transferred me in 2 days. And then when we had meetings, he was the person who drove me to into this entrepreneurship. So that's my answer.
Sir. Another question is from Afrin Khan. Whether higher education is required to become an entrepreneur, or whether it is possible with lower education also?
So the answer is that you need idea or you need invention. Like I already mentioned, that if you got an idea, also Vishal sir have already explained about this, that you can become entrepreneur just with idea, but then
See,
you
the
need
idea,
all the skill.
just 1 minute. I want to answer this question. See, the important thing is that higher education is always important to inculcate the knowledge. but the mindset is never bothered. Correct. The person's mindset in that idea doesn't require anything. Dabbawala, it's a big example. Is he educated? But currently the Dabbawala is making an IIT presentations and giving the skills. So idea, if you have that particular idea, that idea can do wonders. This is what is my belief is. So idea is more important. Yeah, it doesn't mean that the increasing your knowledge or doing B Pharma, after B Pharma, M Pharma and other PhD, postdoc, you should overlook it. It is always there. But that idea can come by doing the B Pharma.
Yeah.
So with that idea, you can make yourself fulfill all the dreams. Okay.
Yeah, also like I want to just add into this, because the topic came with Dabawala. So there is a small child who actually has started a new startup collaborating with this Dabawala. You can actually have there is a video with Vivek Bindra. Vivek Bindra has interviewed that small child. He had an idea that actually you can get the courier at the same day. So he got that idea, and in collaboration with Dabbawala, he is now executing that. So actually, yes, having a higher education will always help, but it doesn't mean that you
If you
cannot
don't have
become
higher
a
education,
person.
it doesn't mean that you don't have an idea.
Yeah. So anybody can have an idea. Yeah.
Okay, sir.
Okay, thank you, sir.
Another question is that if any person come with you with any some idea, whether there is any chance of that idea is being stolen, then how to protect that idea?
So idea cost just zero.
Yes.
Execution is important. Yeah.
I want to give one example, Praveen sir, with your permission.
Yeah, sure.
See, the person who have asked this question is Patel Junaid. Am I right?
Yes.
Yeah, Patel. Yeah, Mr. Junaid. Hello. If I will give you 10 paisa and you will give me 10 paisa, how many paisa you are having and how many paisa I am having? 10 paisa each. But if you will give me one idea and I will give you one idea, how many ideas you will be having and how many ideas I will be having? You will be having 2 ideas and I will be having 2 ideas. Ideas can never be stolen.
So
thank you.
I want to add into this that, if you don't actually talk about your idea, that idea is never going to become successful. So I got a very good example of my friends. One of my friend is very innovative. He is actually principal of a college, and he's in Nagar only. Whenever I visit to him, every time he gives a new idea, but the idea never get executed, and that means there's zero.
There is a problem.
Yeah. So if you think about Uber and Ola, both are similar. The ideas are same. You can take my idea and you can execute. The result will be different, and the idea which I am executing result will be different. So no idea can be stolen.
One minute. And in case if you will take your idea and we will try to execute, we will not be able to execute that much. This is 100% sure, because it is your idea. It is your brainchild. It is your brainchild, and you know the better it. Second thing, Sonai Foundation always follow the professional confidentiality. We always believe in it.
And just one more thing I want to add.
Please.
As a from the healthcare, if you think about the big pharma companies, they actually now collaborate with small startups under the open innovation platform.
Correct.
To build the small startups idea and grow it into product. They are helping the startups. They are putting investment in the startup. Why are they doing? They can actually have that idea and can actually build their own product, but they don't do, because the idea which you have, you got the execution plan as well. You are not just coming and saying, oh, I got an idea. There is execution in your mind. So that's the thing. So sharing idea is nobody is going to steal, and if they steal also, the product will be different.
Okay, next question.
Okay. Okay, sir. Thank you, sir. Is anybody is interested to ask the question? Yes.
Anyone?
Yes, sir. Shall we stop,
Yeah?
sir?
Yeah,
we
I
can.
think,
We can.
yeah, we are.
अरे माझा प्रश्न घ्या ना.
Ha.
बोला बोला भाऊ बोला. Sorry.
Yes.
Net sir. Hello sir.
Yeah, please.
Doing M-Farm, how we can focus on both projects as well as grow up the entrepreneurship.
While doing M Pharma.
M-Pharma project.
Okay.
So side by side, how we can grow up our entrepreneurship mindset and the development.
Okay, so I think that's a good question, because that's the reason we actually got this online platform now. So that's the reason we got this science entrepreneurship course. So that way, when you are doing your B Farm or even D Farm, masters, you can actually learn the skills which are needed for science entrepreneurship, and you can build your mindset. Here I want to tell you that we are specifically focusing on science entrepreneurship. There are a lot of information available, but then science entrepreneurship is a bit different here. So we got the platform for that. While doing your masters, you can actually come on our platform and you can build the skills. That's what I've explained in my presentation.
Okay,
Yes
sir. Thank you,
sir.
sir.
Thank you very much sir.
Yes, sir. Thank you very much, sir.
Thanks.
Now, sir,
Thank you, sir.
just switch on your camera, sir. All of you will have small snapshot on screen.
Okay.
Just all of you, please switch on your camera. Yes, sir. Okay, thank you, sir. Now we will move toward the vote of thanks. So, on behalf of Mula Education Society's College of Pharmacy, management, principal, all the teaching staff, non-teaching staff, and from students, I am very much thankful to Sonai Private Limited, founder president Dr. Praveen Bade, who has accepted our invitation and delivered a very good session on time to decide whether we can go for entrepreneurship or job. Also, I am very much thankful to Mr. Praveen Khare, who has explained very nicely what are the skills required for our students to become an entrepreneur or to become a skilled person. So at last, I am very much thankful to one and all. I am also very much thankful to all the participants who have joined this webinar and given their precious time. And at last, I think that the aim as well as objective of this webinar will become successful if any person come with a small idea and he can use that idea in his future. Thank you. Thank you one and all.
Thank you, everyone.
Thanks.
Thank you,
Thank you,
everyone.
sir.
Thank you.
All the participants, thank you. Have a great day.
Okay, thank you, sir.
Thank you, sir.
Thanks.
All the participants, hello, all the participants submit your feedback. The link will be shared on your email. You will get the e-certificate.
Okay.
Thanks.